Hi, welcome to Suman TV. Whole world is facing a major problem, that is diabetes. So people are acquiring or adapting to so many variety types of treatments, but homeopathy is one of the best treatment what I suggest. But presently we have homeopathy Dr. Srikanth garu. So let's discuss some treatments about diabetes. Hi sir.
Hi.
Sir, you should tell me, sir. I heard that homeopathy is the best medicine for the diabetes, for the treatment, sir. So, how can we treat this diabetes? What are the types of diabetes, and what are the different types of treatments you have in your homeopathy?
Yeah, correct. Like homeopathy has a better role in controlling diabetes, but very minimal role in insulin-dependent diabetes, type 1 diabetes. But gestational diabetes and early onset diabetes and elderly obese diabetes, for them homeopathy 100% we can revert diabetes at an early stage. Once they are dependent with the insulin, already 20-30 years they are on all hypoglycemic medications and insulin. For them we can't answer like homeopathy, but we can reduce the dosage also. So generally homeopathy treatment is homeopathy generally treatment style will be, we treat the patient as a whole.
Is there any stages, sir, in the treatment, like pre, post, and mid? Is there any treatments for diabetic patients?
Yeah, any strong family history is there, and if their insulin resistance is more, like a fasting insulin levels are more, and they are obese, and they have a hypothyroid, these things, then they are prone for diabetes. For them also homeopathy treatment plays a role. Like after screening them, after taking a medical complete history after them, then we can start homeopathy treatment so that we can avoid entering into diabetes for them. And during diabetes, early onset diabetes, like recently detected diabetics, for them homeopathy with simple lifestyle changes, we can address them with a good homeopathic medicines which have a very potent insulin secretion and insulin resistance decreasing medicines are there. So they will be non-diabetic over a period of time.
It will revert back.
It will revert back.
Okay, for sure, sir.
For sure, early onset diabetes and early detected diabetes, they have a sure. And for gestational diabetes also, homeopathy has a good role. Like I have 2 to 3 cases of mine. So many gestational diabetes patients are there. Their HbA1c is more than 6.4 like that, and where the gynecologist is advising to take the insulin, but with homeopathic medicine along with our gynic regular supplement medicines, I am able to treat them till their delivery time. Their sugar levels are maintaining HbA1c less than 6, and fasting levels are less than 110 like that.
And in your experience, I think you have seen a number of gestational diabetes during pregnancy, sir, for the pregnant ladies. Does that continue after pregnancy for few people? I heard like few people they may carry this diabetes after pregnancy also. Yeah. To stop this gestational diabetes after pregnancy, how helpful your homeopathic treatment is?
The main culprit diabetes is like a junk food and refined sugars and artificial foods and sedentary habit. So gestational diabetes people, as they are these days pregnancy is a precious thing for the newlywed couple. So much of rest they are taking, and another 3 months or another 9 months they are taking too much of food and rest more, and that is making them diabetic, like obese induced diabetes like that. So for them, with a simple like a lifestyle changes and with education about the insulin and insulin secretion and how the baby growth develops and how the normal delivery happens, like for them, so that with that approach we can able to revert gestational diabetes. But the thing is, too much of medication, and from the birth of a child vaccination starts, and with all antibiotics and frequent infections and artificial foods, these causing insulin resistance to the people. Anything like artificial thing, if they enters the body, then body inflammatory reaction happens. Inflammatory reaction causes cell response inertness towards insulin, that is causing diabetes more. These days recent studies have shown, like whoever the children they have taken more of antibiotics at the childhood, they are more prone to diabetes.
But during childbirth, sir, people are having at the time of birth, kids, especially
Yeah,
children,
neonates. No?
neonates are having antibiotic infection. I mean, bacterial infection or blood infections.
Yeah,
They're
CRP levels
giving,
are
yeah,
increasing.
they're giving a lot of
Lot of
antibiotics.
antibiotics through
So, what is
intravenous.
the stage or what is the fate of those neonates in
The thing
future?
is, like, yeah, these days, like, mothers are not lactating and feeding the children properly. Breastfeeding is not like
Happening.
happening as it should be. So, and colostrum, like all the deliveries, most of the deliveries are C-sections only. The colostrum, which is like secreting at the first hour and first 6 hours of the birth of the child, that is deprived. Like so many neonates, the mother is on a other bed
Under
and a child,
anesthesia.
yeah, under anesthesia, and mother is in one bed and the child is in another bed. There is no contact and no warmness of the mother and the child. So the secretion, lactation is decreasing, that causing more prone for infections of the children. And the environment and these things are more vulnerable for the infections. They are taking too much of antibiotics, but simple care and proper nutritious food for the mother and child, that makes them resistant towards so many infections, and they can avoid all the antibiotics for so much of heavy antibiotics for the lifetime.
So, what is the basic protocol you use for diabetic patients for treatment, sir?
First, we take what are the main symptoms he presented with, why he has gone for the sugar levels test. So that is the main symptom. What made him to go for an investigation, and second thing, what is his lifestyle, how many times he is taking food, and what are the things he is eating, and what is his family history, how many people are diabetic, and any cancer history or tuberculosis history, and how about his medical history, like he has taken any antibiotics and he suffered with any major illness and frequent typhoid or any jaundice like things like intestinal disorders. If he suffers, then they are more prone for diabetes. So all the things we take into consideration, and complete case history, and constitutional treatment is a major key role in homeopathy. Constitutional treatment means what is the built up of the patient, and how he reacts to the environment, and what is his mental state, and what is his sleeping pattern, and uh, how he wants to be, like what is his desires and aversions, and he wants to be in a company or alone, or what is his mental state. All the things are considered, and in homeopathy we have a miasm like thing, the disease causing agent. We take the miasmatic treatment, anti-miasmatic treatment, so that homeopathy can assure a early detected diabetes to completely revert it back.
Okay. Thank you so much, sir, for this valuable information. Thanks a lot. So, for more diabetes updates, please watch our Suman TV. Thank you so much.